Alrighty. Hi everyone. My name is Sarah. I'm Med 3 or year 3 student. I did my research on a case that I found very interesting, which was Cushing syndrome induced by herbal supplements. And I'll just take you along the process of how we went about it and how it was presented. So we had a 20-year-old and early 20-year-old female coming into a primary care physician's office complaining of weight gain, complaining of striae, complaining of, the typical symptoms, buffalo hump, weakness, fatigue. And she basically, that was her main concern. She was originally taking an herbal supplement, and I'm going to give you a backstory of why she was taking the herbal supplement. She started taking an herbal supplement due to her having a leaky gut. So, as we know, if antibiotics are prescribed for an X amount of time, it does affect the gut lining. And she was taking antibiotics from a dermatologist for over a year, maybe 2+ years, and it affected her gut. And she really wanted to take the natural route. She went to a specialist and decided to get help in the natural medicine aspect. And she did have a history of PCOS as well. So she was taking OCPs and metformin. And she was prescribed this herbal supplement to help with her gut lining and to help with her skin. Now, this herbal supplement was basically just a bunch of plants. It's not FDA approved or controlled. Not many doctors or even dermatologists or pharmacists know about it. It's specifically used in Chinese medicine, and it's used in the herbal supplement community, or the natural medicine. And she was taking around 6 pills per day of this herbal supplement, and she was taking it for over a year. Now, every time she would stop using the supplement, it would just break her out in hives. She would have a severe reaction, and she would go back on it because she's afraid that she's going to be broken out in hives and bloated and not feeling so great. So the main thing that actually caused her to come, like I said, to her PCP wasn't her breaking out in hives if she stopped the medication or the herbal supplement. It was the weight gain. Now, this was in the time early, early COVID, so everyone was wearing masks. So this patient went to her PCP, and she was just asking him to, test her for a bunch of different things. She went on Google, found that there's different reasons why a person actually gains weight this amount in such a short amount of time. And she was asking to get tested for her thyroid, for Cushing's, etc. She actually took off the mask, and the doctor seen the moon phases. So that her PCP noticed the moon phases, and as you guys can see over here, this is what she was presenting with: signs of Cushing syndrome. Typical moon face, purple striae, abdominal fat or fat deposition or gaining weight in her abdomen. She had a buffalo hump. She had weakness. She had fatigue. Even her bone density was decreasing as well. So the doctor decided, her PCP decided to do a 24-hour urine-free cortisol test, and that he wanted to see, is this possibly, Cushing syndrome, although she was not taking any steroids. So we did the tests, and as you can see, with with if it was steroid induced or exogenous induced, this is what the results are going to show. This is what the plasma ACTH is going to be. This is the serum cortisol levels. It's different from if it was an exogenous or endogenous, so inside, like it produced by a tumor. If it's produced by a tumor, the levels are going to be different. The cortisol is going to be increased. But if it is due to exogenous use, if you're not taking any type of steroids the night before or any of that, your levels are going to be extremely decreased. and your plasma ACTH is as well. So they were confused. He sent her to an endocrinologist. Endocrinologist told the patient, just stop taking all medication, stop taking the herbal supplement. No one even had an idea of maybe it is the herbal supplement, because it was ran in two different programs in pharmacy. Wayne State University Pharmacy School put it in their program, ran it to see what the ingredients are. And they just found a diuretic property. So everyone was confused. However, when we asked the patient to stop taking all medication, that caused her to go into adrenal crisis. Now, she was in adrenal crisis. She actually went to the hospital. She was rushed to the hospital. And as you can see, this is the facial rash the manifestation that she had during adrenal crisis. Her organs were shutting down. She was in shock. And instantly she knew that she was in adrenal crisis. She let the ER doctor know. They started giving her cortisone or steroids. And at that moment, we needed to do a little bit more investigation into what this herbal supplement is. And the herbal supplement, as you can see, this is what it's called, Valbon Ji Yang Wing. So that is actually very easily accessible because it's even sold on Amazon. So we went ahead and we did research, and we went into each and every plant that it had. It had over 30 plants, and multiple herbal ingredients in it had steroidal properties. So these plants actually acted as an anti-inflammatory, and it had a steroidal property. So it was acting as if she was taking steroids, and that's why it induced Cushing syndrome. And of course, as we know, the hypothalamic pituitary adrenal gland, adrenal axis was affected. So her adrenal glands fell asleep, because when we're taking a supplement or a hormone exogenously, our body doesn't feel the need to produce if we're already having the amount that we need. Adrenal glands fell asleep, and she had the typical presentation of a Cushing syndrome patient: diabetes, high cholesterol, LDL levels were increased, as you guys can see in this initial laboratory testing. Her hemoglobin A1C was 6.4. Although it's not extremely high, the patient was on a strict diet. Now, the patient was on a really strict diet because she thought that she was gaining the weight from her food or her diet or not exercising. So 6.4 for the strict diet she was on is pretty elevated. Even her white blood cell count was increased. Her FSH was altered. Her testosterone levels were also altered. Estrogen levels were altered. And the crazy thing about it, although this is a study specifically on Cushing syndrome, what I found interesting is that her cysts on her ovaries, she had PCOS, were no longer there. And when I did a little bit more digging, I understood that some of these plants actually had anti-adrenergic. So anti-adrenergic, I don't know how to pronounce it. I'm sorry about that. But basically, it decreased her testosterone level. It also decreased the androgens in her body, and it decreased the amount of cysts she had. So although there is speculations, or there's a lot of different studies that link inflammation with PCOS, this was a really good eye-opener that if you have Cushing syndrome, that means you're taking the steroids, anti-inflammatory properties in these herbal supplements, and that means there is somewhat of a connection to PCOS. So her PCOS was cured, no cysts on the ovaries, but unfortunately, she developed Cushing syndrome. So I really wanted to go ahead and like do a study on this case, because not every day we find, people that are on herbal supplements experiencing such drastic results. So we actually had to treat her as if she was a typical Cushing syndrome patient. We tapered her down. We had her on steroids basically and tapered her down for a full year. It took a year for us to get her off of it. And then after it, we did follow up labs, and thankfully her ACTH levels were normal. Hemoglobin A1C went back to normal. Cholesterol went back to normal. Her testosterone, FSH, the DHEA, everything was falling back to normal, and she was able to reverse all the hypertension, the diabetes that she developed, and even the bone weakness and the muscle aches. All of that was reversed, but it took over a year for her to heal. And this is why I really wanted to do a study on this, because it's highlighting an atypical presentation of Cushing syndrome. And us as physicians, we do ask, do you take any herbal supplements? But we don't take into consideration other signs. And if it doesn't fit the profile, if they're not taking steroids, we may look the other way and try to investigate other areas and try to find other answers, when in fact herbal supplements could be the cause. They are not regulated. They're not tested, although it is used in Chinese medicine and it has great, positive effects. It could lead to a crisis like we had here. And actually, the prevalence of the US actually using herbal supplements increased during COVID. We didn't have a cure. We didn't have medication that could help. So a lot of patients didn't have the trust in medicine that they originally did. And after COVID, it increased a great amount. And even from 2017, I think it increased about, from 2017, there was a 42% increase in the amount of herbal supplement purchases in the United States. So can you imagine what the numbers are after COVID? So yeah, that's really all I really wanted to do, is showcase this study, let the public know in the future, physicians know to keep an eye out, even if you don't have the typical qualification or characteristics, or they don't fall under the typical profile. Keep an eye out for your patients. Ask them what they're taking. Maybe do a little bit of research on the herbal supplements itself. I know that's not our specialty or our area of specialty, but for us to take a few more minutes, or have someone's help in your staff take a few more minutes and just dig deep, I think could save a life. Because if this patient didn't actually go to the hospital and she was in adrenal crisis, she could have